Hi, my name is John Kolman. I'm Vice President of Translational Medicine for QPS. I am an academic, a scientist, and a businessman. My role is to help pharmaceuticals get drugs to market to take care of the people on this planet. Our company is, I think, a very significant contributor to human health going forward. I think that CROs provide an incredible service to pharmaceuticals, providing for them the controlled, regulated studies they need to get the data to submit to the FDA so we can get drugs to market as quickly as possible. The next steps for our business, I think, are to remain adaptive, attentive to new science, attentive to new regulations, attentive to very close interactions with our clients. This is not an easy business. You have to be very good at, I think, a large number of things to do it well. Given the increase in outsourcing to folks like us, to CROs around the world, our ability to make relationships and focus on communication is incredibly important. So for us, it's really a lot of talents, a lot of skills combined together. Science, communication, attention to regulations. It's quite a package. The field will likely not be where we are now, just based upon the past 5 to 10 years. As we learn more about the kind of work that we do today, there are many changes that are quickly implemented. There are things that we used to do that are no longer required. There are things that surprise us that have to be taken into account scientifically and from a regulatory point of view. And I think also the kind of drug molecules that we study today are very different, and they will continue to become more different and more mature. We're at a wonderful place, I think, in the industry and for humanity to bring new, interesting, important, effective drug molecules to the market. But as they become more sophisticated, we have to invent the tools and the approaches to test them well, make sure they're safe, and do it as quickly as reasonable as well. The key hurdles. I think we need to be patient with one another, and we need to understand where we're coming from and what the objective is. The objective is safe drugs as soon as possible. I think that we all need to be patient with the regulators. The regulators don't write down scripts for exactly how we're supposed to do, for example, an ADA assay. What they do is they generate guidances. Okay, and the guidances are maybe a little bit more obscure than the scientists like, but in fact, they're not meant to be rules of the road. They're meant to be guidance for a specific reason. That is to say, there's more than one way to skin a cat. There's more than one way to get a scientific answer and to do it well. And to a certain extent, by seeing the diversity of answers, the regulators get a feel for things even beyond what they have been concerned about and are able to implement that in the next set of guidances. What's fun about being a CRO is that because we interact with so many people, we do see how everyone does it differently. And I think they'd be surprised to know how similar they all are. Okay, they're all, pretty much in line, and they're all, for the most part, doing a very good job. It's a pleasure to have sort of that point of view, and it's also a pleasure to know that we're doing a good job together. And if there's something that we can do to help them out going forward by saying, well, maybe you should consider this, or maybe that's a little odd, it's a service that we can provide to them, and it's a way we can be invested in the process ourselves. EBF is always a fun show. I love coming. I probably don't spend as much time seeing as many talks and posters as I like, but I love meeting the people. Okay, I love seeing the passion that everybody has for what they're doing and what's new and what's interesting and what we should think about, and it makes me think a lot. So seeing friends and getting that rejuvenated sense of, oh yeah, I like quite a lot. The EBF conference in one sentence. It's a bit of a lightning rod in a good way. It's a collection of hard-working people talking candidly and constructively. You matter. Don't lose heart. Work hard. I think sometimes scientists struggle with what their contribution means in the big picture, and I think you'd be surprised. Big contributions come from all over the place, and small things that get another person to think about something differently, or to make somebody aware of a concern, or aware of a control or a matrix effect. I mean, whatever. All of those are significant, and we welcome them and we need them. You're part of a much bigger process you should be proud of. I don't think I have a single hero. That would be fun if I did, but I think the hero for me is the process. Um, I've seen a lot of academic papers that have made significant contributions to the field where it might be some sort of gel-based analysis where there's literally one band and two band and a third band and a third lane. And we all applaud because it was a remarkable observation and it was new and it's important and maybe it opened up a field. But at the end of the day, that one piece of data, as it was presented, would never get through the FDA or EMA. Okay. It's because of the combined work of the pharmaceutical scientists and the research scientists and the regulators that we start to build assays and tests that are, without a doubt, report the correct result. So for me, the hero of bioanalysis is going from work that is new and discovery-based into something that is absolutely, inscrutable and not inscrutable, but unquestionable, and that is what bioanalysis has done for us. So it is the process that is my hero.